Thank you, Emily. So protection, so important. There are whole careers associated with helping patients not get hurt. Okay, same with if you want to ride a motorcycle. Probably the fastest way to ruin your thorax. Because why?
There's no protection.
There is no protection, Parsa. You can get such a bad injury because you are taking the place of the bumper, right? On a car, you got these bumpers on a car, and if you hit something and you have your seatbelt on, your chest cavity is protected. I have a memorable patient. When you work trauma, you have memorable patients that stay in your brain for the rest of your life.
Oh, wow.
So I had a patient once who is about your age, you guys' age, and he had gotten into some gravel on a motorcycle and tried to turn out of the gravel and accidentally hit the accelerator instead of the brake. The brake would have braked the bike and thrown him off, which would have been good. But what happened was he fell over on the cycle, pinned his leg underneath, and then the accelerator spun the bike like this. So his chest cavity was in the gravel and his shoulder, and it just spun his chest right down into the ground. Broke all these ribs, broke this bone. What's this bone right here? Anybody know? Parsa knows. Humerus. Ground his shoulder capsule into hamburger. Okay, and he had, of course, a big surgery, a big recovery. So yeah, somebody's just said on the chat line, that must have hurt. You know what, guys? He was so unconscious when we got him. We kept him asleep for days.
Did he even feel pain?
He was out. So he lost consciousness from the centrifugal force of going around and around. And so when we got him, what do you think the very first thing we do in the emergency room when we get this patient is?
Take pictures?
No. There's no time to take pictures. What do we do? Thank you. We make observations while we're working, but what do we do first?
Make sure he's alive.
Yes. So we look at his airway. And so meaning, I want to take my mask off just for a second so you can see. One nurse is holding his chin up like this. And what we're trying to do is just stretch out his breathing tube, his own airway, to make sure it's open. And we're listening, putting EKG on the patient, putting oxygen in the patient's nose. And then we put an IV in the patient, just boom, as fast as we can and as big of an IV as we can. Usually somewhere in here because there's a nice big vessel right here, and then we'll move it around later. So the reason, so that we can instantly give the patient pain medicine. So we just instantly sedate the patient so that if he does wake up, he won't remember it anyway. So that is just standard operating room protocol involving protection of patients. Now, of course, your skeletal system is your primary source of movement. Everybody knows that. But a lot of people don't know that you can die from being immobile, right? Do you know this? So if I take Eugene and put Eugene in an intensive care unit, I don't want to ever do that. Okay, I'm just saying. Put him on a ventilator, and we have to paralyze people to put them on a ventilator, right? Because what would you do if I took a tube as big as this is and shoved it down your airway and then hooked it to a machine that breathes for you every 5 seconds? Well, you would pull it out, right? I would too. I'd be like, out. No, I'm not having it. So we sedate the patient, and everything, all your muscles and all your bones are absolutely like, okay? Your osteoblasts, your bone building cells will go, don't need to do anything right now.
Like your heart and stuff.
Your platelets, the things that make blood clots, will wonder if they should stick to each other because your blood flow will slow. So when you're talking about putting a patient completely immobile, movement, body movement is what moves our immune products around. It's what keeps us from having blood clots. It's what gives us chemicals so that we can feel happy. or sad, lack of movement is life-threatening to patients over time. That's why for patients like, a teenager in the ICU who's been in a big accident, as soon as we stabilize all their skeletal structure, like say, so it's this patient, they broke their humerus. As soon as this bone is pinned, and as soon as that shoulder is reconstructed, all the nursing staff will be like, that patient's getting out of bed now. So even if we have to lift them out and sit them in a chair, we lift them out to give chemical signals to preserve your homeostasis. Stop blood clots, don't get an infection, wake up and talk to us a little bit and be oriented. Let me let Yuseli in. No, Kenneth, it's not, and I'll tell you in a minute. So people are asking me questions like crazy. Okay, so when you think protection and movement, and especially because our book is simplified, you're always going to see me amplify what this actually means in medicine. Movement is everything. So if we have a premature baby that's born, do I have something? So a 1.5 pound baby is about the size of my coffee. Way teeny. We have medical professions, physical therapists that do exercises on that baby every day. Because when you're 1.5 pounds as a baby, your motor cortex usually is a little sleepy. And so you'll have a physical therapist that will do like little tiny leg lifts on these babies every 4 hours. Reason? Movement equals homeostasis. That's why now in the United States, we have so many old people, right? In the US, we have the boomer population. I'm like the youngest of the young boomers. Like my brother is 10 years older than I am. So much arthritis, so much people that are like, oh, I don't feel good. Guess what all the doctors say is the solution to all your health problems? A 30-minute walk every day keeps you off blood pressure meds, keeps you from having diabetes. Movement. So important. Okay. So yes, so I want you to draw this now, if you would please. Just copy this onto a piece of paper. It is in your reading on page 35. I am going to call for it. So at some point I'm going to call. And what this is just an expanded picture of what we drew in last class. So last class, I drew this. Can y'all see that at home?
Yes.
Okay.
Yeah.
No, it's a great question, Emily. I probably not going to get to that bone marrow question today, but I will get to it tomorrow. So hold that thought. So what we're looking at right here are called osteons. That's what I drew in the last class, but I never labeled it. Those are those little things that look like this that have embedded osteocytes that we drew last class. They look like this. They have a blood vessel in the middle. Those are compact bone. And generally, so you have connective tissue. If this is the outside of the bone, these stripes are connective coverings. Okay, that's called periosteum. The outside layer is periosteum. Osteum. Peri meaning around. Osteum bone, around the bone. Connective tissue, that covering, the outside covering is periosteum, and then there's connective tissue. This is also what holds your bone together and has some flexibility. So it has collagen in there. So that patient that we talked about that fractures their hip by turning, their periosteum becomes brittle when they get old and kind of easily cracked. Yours is flexible like elastic. So if you get hit in soccer, big time, like somebody slide tackles you and then gets a red card and you get a broken leg. Okay. Your periosteum could not withstand the amount of pounds per square inch that some giant person slide tackled you with. Okay, so compact bone provides this rigid strength, and then the inside is spongy bone, a softer variety. So the red things I drew in there are all the blood supply. Remembering that blood supply equals oxygen. And what else? What else is in blood that you need? You couldn't say again, calcium, what else? Yes, calcium. What else?
Vitamins.
Yeah, nutrients like what? So anytime in health careers, like, or in science in general, you're always gonna have this health in here, but you're gonna have to have it in college too, is when you say nutrients, I'm gonna say what nutrients. So if you give me a big category, I'm gonna say, give me some part of it. So glucose. Remember, you can't sell, these are cells. So they can't do their processes without the use of glucose as well. So you're seeing outside layer, compact layer, spongy layer. That is all there is to this drawing. That's all I want you to remember today. So this takes place, this structure, we'll draw that actually later, like, you know, your femur, which looks more like a dog bone, has this compact layer here. And then the spongy layer here. Okay. Contrasting that to a flat bone, if you've done the reading, which I'm sure you have. It's like what? Yeah, it's like a sandwich, like in your head. Like your skull has the same 3 layers, but it looks more like this. So it looks more like you've got this compact here, spongy on the inside, and then compact underneath. So I have a question for you to think about. So you've got a compact layer here and a compact layer here. Really big protection, right? So that's going to go all along, like there's your frontal bone there. It's going to go all along here. Why is this also dangerous for a patient that gets a head injury? So the same patient, the guy on the motorcycle that was, every time the motorcycle went around sideways on the ground, his head was hitting the pavement, like cyclically.
Also, the brain can hit the outer, like inner layers of.
Exactly. So for that
That's
patient,
dangerous, right?
oh my gosh, say again,
That's dangerous.
again.
Like, that's not good. That's dangerous. Like,
Oh my gosh, so dangerous. Here's why, Eugene. Here's why it's so dangerous. So your brain is encapsulated in this rigid covering, right? Except for a little hole right here at the bottom, a big foramen where your spinal cord starts and your brainstem comes down. This is all enclosed with the exception of the orbits of your eyes, a little bit on your sinus, and this hole in the bottom. The rest of this is all hard. So when this patient is hitting their head on the pavement, the inside of your head is getting injured. And what happens when you get an injury anywhere? Like if I
Stops working.
if I get bitten by a spider, it's an injury. This has happened. I got bitten by a brown recluse a few years ago. So the spider bites me, releases the poison into my arm, and then my immune system sends tons of T cells and B cells there to go like, what do we do with the poison? The result is, when I got bitten by the spider, my brother took a picture of it. He photographed my 2 arms. This arm was this size. This arm was the same size as my leg. The swelling was so fast and so huge. We went right to the emergency room. Okay, good. That was good. Same thing happens in your head, except for around my arm, I don't have bone. My skin will stretch and stretch and stretch and accommodate all that swelling. Up here, the brain is then compressed inside the skull, and the skull damages because the pressure gets so great. In really unusual and nasty situations, the brain will herniate downward into the hole. So this is like a very, very like time to go to the operating room. So in the operating room, this is totally a digression, which is what I love to do. We can make a hole called a burr hole. Neurosurgeons do this, and they do it for one reason, to let that pressure off. These flat bones are so sturdy that they're not gonna break. And if they do, there's been a huge amount of injury to release that pressure. Okay, let me see if there's a question. Okay, now, okay, so flat bones, very sandwich-like, long bone. So a flat bone, the example is your skull. There's other ones, but that's my example. Long bones. Humerus, femur, tibia. So exactly, they look like dog bones. So, but they have the same layers. They have these compact layers and spongy layers. So there is marrow involved. That's tomorrow's conversation. Emily always pre-leads my questions by asking me tomorrow's questions. So that's tomorrow. I'm going to talk about bone marrow a little bit. So questions about that at home or here. Do you need to know these? Yeah, you do. You need to know this structure and why. Your book talks about two kinds of skeletons. This is just a division point. Axial skeleton, meaning my support structures, my major support structures. So healthcare professionals that are physical therapists are primarily concerned with your pelvis and spine and the upper portions of your thorax, because this is what allows you to stay upright, correct? So for you all, unless you have medicine people in your family, it's hard to imagine how much can go wrong here. But osteoporosis would be a big one, where the bones get so porous that the patient's vertebrae in their spine can't stack on top of each other anymore, and they break. So we have a patient who's a favorite of our program, who's over at one of our facilities where we take students. She is lovely. She's probably 85. She's completely oriented. She loves to tell stories. And this is her posture. This is how she stands. So this is how she walks and stands.
Wow.
Because her axial skeleton is so weak that she cannot stack her vertebrae on top of each other and stand erectly. A lot of it is because you lose bone as you get older, and you lose muscle mass, and your muscles are replaced by fat. Remembering that our muscles are also what provide structure. So the two of them together. Yeah, students always ask me when we're around her, and she loves healthcare students because they're nice to her. But they'll always ask, can't we do something like for her? Can somebody not do something with her spine? Not because she neglected it for so long. Her vertebrae are fused in this kind of round position. They're stuck together. If she had done it when she was here, yes, a spine surgeon, orthopedic doctor could have helped with that. And she was what I call sedentary. She didn't move. She was a couch potato. And she will tell you how much she regrets that now. She was a sort of a middle-aged woman when TV came into the US. Okay, this happened to a lot of Americans. Busy, active, gardening, riding their bicycles. Color TV shows up in the US when I'm a little kid. And a lot of Americans just went to the couch. They did. And then it was just like, what did you do today? Watch TV.
That happened to me the first few months of quarantine.
Yes,
only
oh, I
played
love
video
it.
games.
Yes. Yeah, because your routine is so disrupted, you don't know what to. Did you get sick of it, Eugene?
Kind of, because I used to have PE, and we would like run miles on Mondays and like play soccer and stuff.
Yes.
And then like be all day at home with no friends. It was terrible.
Yeah, and I think that, in terms of in the US, in terms of mental health worldwide, people's routines are disruptive, and it's a little bit, you think it's going to feel good to watch TV all the time, but after a while, it kind of makes you feel depressed.
Yeah.
Like, if I spend too much time watching TV, I feel terrible. So I think it's such a great thing for you all when you guys are older and you have your families to remember, like, learning to do things, like becoming good at something, becoming really good at running. Running is an amazing, helpful activity for long-term health. There last year, 2 years ago in the Portland Marathon, there was an 84-year-old man who finished 26.2 miles in the day.
Wow.
Okay, so we're talking, some people can have amazing fitness. Yeah. Oh, okay. So some students are mentioning their orthopedic problems. Yes, young people get orthopedic or bone problems. So we should probably add these to your big list of just for medical knowledge. Let's add them. Oops. Can you guys see that at home?
Just only the left side. Could you please move it to the right, please? Thank you.
Yeah, so this says scoliosis. Scoliosis is when the axial skeleton, spine and pelvis have a lateral bend. So it goes like this. Okay. So, and there's a million varieties of this. Somebody's trying to tell me about it online. Yes, that's exactly right, sedentary, but this is just a genetic issue. So this is scoliosis, a lateral bend in the axial skeleton. Kyphosis is what our patient that had the osteoporosis has, which is this. This is kyphosis. And some patients will develop this weird, like, fat deposit between their scapula called a kyphotic hump. And it can make them look kind of scary, but they're not scary. They just have an orthopedic problem. So this is kyphosis. Are you seeing me at home? Yes. And this is more of scoliosis. Like I have a tip. One shoulder's higher than the other. Axial skeleton.
And chiropractic, they fix that, right?
They can if it's not severe. So Eugene's question is, can chiropractors do something about that? Dr. Rom's at a golf tournament today. But yes, if it's not severe. So depending on the severity, sometimes we can recognize this in an infant.
Yeah.
You know, like they're born and you can already see that there's an issue. And of course, then remember that infants have a lot of bones that aren't quite fused yet. So their skeletal is much more movable than even when they're 2. So yes, this can be fixed, and there are chiropractors that work on infants as well.
Yeah, I've seen videos when they fix the baby.
Good point. Excellent point. So, okay. So, and then appendicular skeleton is your arms and your legs. And we can get into all kinds of quote disease problems with your arms and legs, some that are genetic, born with it, some that are like our patient that took the big fall on the motorcycle and did the big spin. So by the way, that guy completely recovered. He was young, which is very helpful. His tissues are more elastic. He had a really, kind of responsive immune system. His heart and kidneys were great. Yes.
One
He had brain
time
surgery
in the
too.
Olympics, I saw that this lady, actually one guy, he didn't land correctly and he broke his knees. And,
What was he doing?
he was like running and then jumping and doing like
Oh,
gymnastics,
gymnastics.
and then he didn't land correctly. And then I saw another lady and she landed and she broke her knees. And I read that they recovered in like 2 weeks because they are
So young, and they're so young. And I think too, in professional sports, we can use things like growth hormone and like, our family has a really good friend. This lady happens to be a psychiatrist, but she just had her 99th birthday. Okay, she's an amazing lady. Okay, she's 99, totally great. She lives by herself. And she fell when she was 97 and broke her back in getting out of the shower. Okay, and what do you think I thought about that? When she called me and say, "Hey, Andy, I broke my back," I was like, to myself, I would never say this to her. I thought, well, that's it. You know,
Yeah.
she's not going to recover. Her bones are so old. She'll never recover. You know what? She was recovered in 8 weeks. They put her in a brace. And her doctor said, you're not gonna recover, you're so old, your bones won't mend.
Oh,
Alice, her name is Alice. You guys would love her if she came. She walks every day for 40 minutes. She moves her immune products around. She moves her blood around. She doesn't really love TV. Yes, Eugene.
I know an old person that broke his back.
Yes,
It was my best friend, like his mother's father,
yes, grandpa.
actually his grandpa's father.
Yeah,
He
oh,
broke his back
yeah,
when he was walking home. It was
Yes.
in Panama. It rains every day.
yes.
So the floor was wet. He fell and we had to like call 911. And yeah, he recovered in less than a month.
So you
He had
guys
surgery.
don't be what I call, and I'm a little bit this way too, I can be this way. I don't know, guys, Kenneth, if you guys can hear Eugene's example of a grandpa who amazingly recovered from a big back injury at a very elderly age. It's very easy to become what I call ageist, which is like, my friend Alice is a psychiatrist. And you're like, really, what can you do in your 90s? Well, Alice runs a group for lonely elderly people to help them manage because a lot of their spouses are gone. So Alice runs like a therapy group for elderly people on how not to be lonely. So that her work is so vital and important way into her elder years. Now, we have other elders that sit and watch TV all day. And they're not very productive. They're not moving. They're not exercising really good caution in terms of all these functions. So just, we get to choose how we want to be. I don't, Alice, not Ellis, Kenneth. Her name is Alice, like Alice in Wonderland. Yeah, okay, you saw it as Alice. That's weird. Okay. Third thing for today, let me move this so you at home can see. Giant Person Project. So Giant Person Project needs a big name at the top. Actually, would you put your name on the back? So that when we roll it up, looks like this. All of you have the outline. You can take it. I actually would love it. I think if you'd leave it here for a few days, just so you can get started. And then I will take, I'm not supposed to take care of your paper, but I'm gonna do it anyway. Don't tell on me. Don't tell on me. If you have one at home, bring it back to me and use this one today. So you can work in class, but that one you have at home belongs here. Then, because you can't have two. So what I want you to do today is to get at page 48. And so always, two students have already said this, I can't draw, Miss Ellis. I go, me either. So in the module, it says this, and in the assignment for Giant Human, it says this. I am not grading your art. I would never do that. Are you kidding? My sister was an amazing artist. Like, I felt so intimidated next to her. Like, we would be camping or on vacation. She'd be drawing sketches of people like that were walking by. And I was like, Miss Stick Figure. I was like, couldn't do it. So we had Miss Donnelly. Actually, what we originally did was we had me lie down on this paper like this. And she traced me, and it was so weird looking that we decided not to use it. So we just went with like a generic human. So what I want to make sure you do though, before you get too started, is get on the module and read the assignment. Because it has some important features. One is to label anatomic left and right. Okay. Also recognize that everything, we're just going to do these first 15 bones on the right hand side. I took this directly off your page, number 48. Do not do the left hand column yet, because that's later, and I have special instructions for that. So those of you that love to work ahead, don't do it. And what I want you to do is to simply sketch this human in pencil. And then when you're ready to outline it, I'm giving you each a Sharpie. So those people at home, I have these big Sharpies. Where is it? I'm giving them away. So you'll have your own Sharpie, your own pencils. We're supposed to try not to share things. That's what I'm doing. And I want you to put these 15 items on. Now, my dotted line here, my dashed line means I just did that so that it didn't clutter up the drawing. We are going to put some things on. This is an anterior view, correct? My scapula, this bone right here, this big wing bone, that's posterior. I'll tell you how I want that done, probably Thursday. But I am going to give you guys the rest of it to stretch out and start drawing. If you need a straight edge, like you want to make a straight edge line, you can do it with another book. I can't give you my rulers because I don't have enough to give away. Okay, so here, do you have a pencil? Everybody have a pencil? Okay, cool. Put your name on the back, and then when you roll it up so I can see your name. If you're gonna leave it here. Here we go. Oh, I know one thing I want to point out. You don't have to make your model male or female. Make them generic. And I put the pubic bone right here. So the pubic bone comes together in the front. Let me draw it for you so you won't embarrass yourself. The pubic bone comes together in the front of the pelvis like this. Okay. Cartilage. Pubic bone. That is right here. Now, fun fact on your pubic bone. It expands when you're walking. So it's not rigid. If it were, you'd walk like this. Okay, so your pubic bone has the ability to kind of shift. That's why you have cartilage in there, soft material.
And it expands when women is going to give birth, right?
Yes. Eugene, I have a friend who broke this cartilage when they delivered a baby. Oh my gosh. So
Like,
for
this
weeks,
like,
here's what she said. She had to wear this sort of athletic tape around her hips after she had the baby, because when she would sit down in a chair, imagine, like it would pull that apart every single time. So she had, I know, so I'm just saying, yeah, that's why we learn anatomy. So when the patient comes to your office someday and says, hey, I know I'm supposed to feel great, I just had a baby, but I have this shooting pain, the front of my pelvis, every time I sit. Yes, that's why we learn that anatomy, so that we can know what went wrong.
Something I don't like about this class and like medicine.
Yes.
You learn everything that could go wrong with your body.
And the thing I loved about it early on, I did 2 years, I was going to be a social worker in college. I took one anatomy class and I was like, you know what? I'm never going to be bored. Because I'm just mentioning a few things, but the cool part of it is that everything we teach you, under normal conditions, you would be like, oh, yeah, cool. You get to learn all these names. When you go to nursing school, you have to know exactly where the ridges are on this so you can know where to poke needles in people. There are landmarks on the top of this iliac bone that tell me where to put an iron shot, where to put an antibiotic. Cool. Same with the ends of the bones that you learn, like where do you put anesthesia in, or where do you put numbing medicine in? It's all useful later. Okay, I'm gonna let you work. People at home, how can I help you? So by the way, you need to have these all on there by Thursday, drawn and labeled by Thursday, because we're gonna do the other half starting Thursday. Thank you, Kenneth, for putting that page 48. It's also on the drawn.
So we're just basically copying that.
Yes, please. So it doesn't have to be perfect. It just has to be accurate. Now, if I were drawing it, I would look at page 48. You guys, many of you will be better artists than me, and we're just doing that left-hand side right now, the front view. Hey, guys at home, does anybody else already have their drawing? So I know that I have enough.
I have mine. I'm organizing it.
Okay, good.
I don't think I have one.
Is that you, Uriel?
Yeah, it's me.
You'll be here tomorrow.
Yeah,
You can pick it up tomorrow.
okay. And I think also Yotzin.
Yes.
I don't
Has
think
one. She
I don't think-
doesn't or does?
I don't think she doesn't.
Okay, no worries.
Yeah.
Thank you. Hmm,
I have a question.
yeah,
So I see that you did kind of like,
just top and bottom. So maxilla, top of the mouth, bottom of the mouth, that's jawline. And then they just under the eye, so like, this
So
is
you did
also,
this?
so yes, this is mandible, like down here, this is your maxilla here. This is just like your cheekbones.
Yeah.
So this is also a really common injury.
In
Like
fights?
in fights, you get hit with a baseball,
Mhm.
it breaks this. And the other reason is, I should back up, but if you feel right here, the bottom, feel right here.
Yeah.
Feel how kind of rigid that line is right there and
Yeah.
sharp. Like any place where you have no muscle, so easily to split it open on impact, like a kid, like do you guys know what croquet is?
Crooked?
You know what croquet is?
Like
Like these
sport?
mallets and you play
Oh, yeah.
outside on the lawn and you hit these wooden balls. When I was a little kid, because I was a dork, my neighbor was standing right here. She's like 9, I'm 7. And I take this big backswing and I hit her right here with the mallet and broke it open. She had like 9 stitches. So just think, it's just what you think about in terms of injury has a lot to do with skeletal. Like if you feel your zygomatic arch, it doesn't have much over it. There's not much protection over it in terms of muscle. Yeah, okay.
And then not doing anything of this?
Nope, so the only thing we're doing right now is this left
Oh,
column.
yeah.
So, but yes, we will do occipital later in the week.
Okay, got it, thank you.
Miss Alice, just only the first 15 left parts, right?
Yes,
All right.
yeah, they're all anterior view too, so it's just not as confusing. So we're just going a little bit of a time and we're going to add some other things on. So look at your PA interest, right? So the biggest PA jobs are in orthopedics, are in bones. Because there's so much that you can do and there's frankly so many patients. So many falls, like so many things like I was describing, that the physician's assistant world is very largely bone injuries. Just FYI. You can do other things, but I'm just saying there's lots of jobs out there for that.
Oh, his eyes are.
You know what? So is mine. So I'm not grading your eyeball. So Parsa, do you do track
Oh, no, I just go to the gym and run.
and do your own running? That's so good.
I also used to play basketball and soccer.
I never ran track in high school, but when I got out of high school, I ran for 20 years. I ran and ran and ran and ran and ran until my knees got tired. And now I'm a swimmer. It's just a lot easier on my knees, but, and I still do hiking, but it's so, the feeling that I love about running is right when you're done running. Right at the end of a long run for about a half an hour, you just feel amazing. So it's so good for you. I always tell patients and students, like, memorize that moment. Like when you, because you're thinking, I just don't want to run 5 miles.
Gives you energy for the
It does. It also makes me fantastically hungry. You got them all on there? Okay, so then you can go ahead and label. Label all 15. They're on this page. Watch the spelling. And then I think you're done after you label. If you need a straight edge parser, you can use a book. I can't give you a, what else could I give you? It's long. It's gonna have to be something out of your backpack that you can make lines with, like on here. Yes, ma'am, you can take pictures anytime you want.
Also brought my biology book.
Excellent. So is that the one you're using now?
It's the one I used last year.
Oh, okay. Where were you?
Iran.
Do you care if I look at it?
In case I don't finish, can I walk at home?
You can take it home, but you just have to bring it back. Okay, don't forget to bring it and bring me the extra one.
Yeah.
Everything that you-
Is this, and this is what?
that's for Apple. These are all.
So,
End of it is fine.
yes, and I think that's something that surprises students if you're a bio major, you're gonna do plants and all kinds of stuff. I'll bring it right
Well,
back.
it's something with.
Oh, I know, I still want to see it. Just hang on a second. When you get this book, do you have to buy it? When you go to school in Iran, or do they give it to you?
The school gives it to you and you have to do all the tests. Like it has a one and a half.
And are the tests on paper?
No, it's there in here, but you have to write it down both, and then try to translate without looking at it. Because
And
then
then turn it in, yeah, so what I call really good practice is what I call. Meaning, you don't get to use notes, because when you go to college. So I feel like we should practice that, but way cool, yes. Yes, you can take it home, but I need your extra copies back.
What time do we leave? 9:45.
Yes. Got about 7 minutes left.
So this zygomatic is this bone.
Yes. So all the way across here, and this is your zygomatic arch, which is the most, so you realize too, Eugene, like, this is the name of this bone, so like this is the humerus, but the humerus also has like 16 different anatomic features, like a map, that you will learn if you go to medical school or nursing school. You'll learn those. We're just learning the big pieces now. Yes, so but your zygomatic arch is this top feature right here. So when somebody has really big cheekbones, that's their zygomatic arch.